Good afternoon, everyone, and welcome to Focal Points. Today, our special guest is Dr. Roger Hodkinson, and he's joining us here today because we have encountered a major problem in 2020, 2021, and all the years after of the highly flawed PCR tests. A recent paper just came out indicating that 86% of the time they were not accurately diagnosing true active infections. And so we clearly will need an alternative. And Dr. Hodkinson here has developed one, and it's looking very, very promising. So, Doc, give us a brief intro to our audience. Who are you? And tell us about this company.
Sure. Well, very briefly, without beating my own chest, I'm a Canadian pathologist trained in medicine at Cambridge in the UK, did my pathology in Vancouver. I've been president of this and that along the years, chairman of the Royal College Examination Committee in General Pathology, president of our local pathology, our Provincial Pathology Association, and so on, teaching positions, run a lab, a big lab in Canada, general duty lab, and our company has operated a molecular diagnostic lab in Michigan and in San Diego. So I've been around the block enough to know, just like you, Nick, about the imperfections of what is currently available in the marketplace. Not to criticize anyone, you use what you can, and what is available is, as we'll describe, very suboptimal.
Yes, definitely. Well, so clearly you are very experienced, for sure, very credentialed. So tell our audience what exactly is MultiSeq doing, and how is this newer technology, this newer iteration, better than the standard old PCR tests that we've been using?
Right. Well, I'm a medical entrepreneur. I'm the chairman of a company called MultiSeq, MultiSeq.bio. That's our website, MultiSeq Inc. We're in North Carolina. We're about to launch our retail service later on this month or February, totally transforming the way infectious disease is diagnosed. The current method is colloquially known as PCR. Well, everyone actually uses PCR, us included, because all PCR is simply a way of making more of the stuff that you then want to identify. It's not a method of identifying anything. It's making more of it. The current method, think of it as a lock and key. You're looking for a certain shape of the DNA representing 12 letters of the genetic code. It has a three-dimensional shape. And you introduce, the current method introduces into that sample a complementary molecule. It's exactly the opposite shape. We call it a probe. And that is the detection method that's got all the notoriety, for the very simple reason, like every lock and key mechanism, the probe, if it's similar to something else that's in a panda or a grapefruit, the light bulb conceptually in that test will still go off. And you get a false positive result because of what we call a partial stick, a partial similarity. There are other reasons as well, but that's the state of the art. And unfortunately, it has another limitation because medicine is called the unknown. When you present to me with an infection, it could be any one of a number of different bugs, viruses, bacteria, fungi, etc. And the challenge is to tell the doctor exactly which one of those is causing the problem. Now, most people, when they have a heart attack or they're in renal failure or whatever, the result comes back within the hour of the sample being taken when you're seen in hospital. Most people don't realize that when you present to a doctor, any doctor, whether it's in hospital or not, with an infection, the doctor makes an educated guess about what the cause is, because the result will only come back 3 days later. And when it does come back, it's very limited in its scope. It's largely bacteriology. Very few tests are done done routinely for virology and fungi and so on. So it's a excuse me, extremely suboptimal. And what is needed is a test that is accurate and comprehensive. In other words, it's testing for a panel of organisms, all the prevalent ones that could be causing your presenting syndrome. And it needs to be scalable and cost effective. That is the transformation that we're bringing to the marketplace with our MultiSeq technology. We call it MultiSeq because we are multiplexing sequencing. We're doing multiple tests in the same tube at the same time, looking for a variety of organisms, bacteria as well as viruses, that could be causing your problem. So our competitive advantages are a comprehensive panel, the fact that we're confirmatory without the guesswork of the light bulb going off with this ridiculous technology that was never intended for diagnostic purposes. And it has to be scalable. So I don't want to get into the details of how multiplexing is done. That's a very technical issue, and it's beyond my pay grade. I'm the chairman of the company, but I'm not the molecular biologist, the founder, the genius that's been running the technology. Suffice it to say that we are going to be producing multiple yes/nos for the prevalent organisms that cause a particular presenting syndrome, and having that reported the same day with incontrovertible accuracy that also circumvents the big problem with any molecular diagnostic method, which is known as cross-contamination. When the bung, if you like, on a sample is popped, it creates an aerosol that contaminates the entire environment where the testing is being done. And if that aerosol happens to land in someone else's sample, then you have the problem of cross-contamination and a false positive result coming from someone else's sample. We beautifully eliminate that threat by adding to every sample a known 4 letters of the genetic code that are different for each sample. So if we're seeing 4 letters coming out of Susie Q's sample that we know we added to Joe's sample, we know we have cross-contamination. We are the only company that's able to give that confirmatory opinion that this was present in this person at this time. That's a huge advance in terms of being confirmatory, as opposed to risking the possibility of those false positives from cross-contamination. So it's a sea change in molecular diagnostics. We have panels for most of the presenting syndromes, such as upper respiratory tract infections, diarrhea, high-risk HPV subtypes, and so on. We're at the point of applying for FDA approval and are intending to raise investment for the next phase of our development, which is to create our own instrument to have in the back office of GP clinics, where imagine this now for a second, Nick. Let's say Susie's in the waiting room presenting with what sounds like a sexually transmitted disease. She will see the doctor, the sample will be taken. Historically, that will be sent off and the result comes back in 3 days. In this scenario, with our instrument in the GP's office, the sample will be taken, and then in the back office with our instrument, the tech will take the cassette with the predispensary agents for sexually transmitted diseases, take that out of the fridge, put the sample in it, put the cassette into the instrument, press a button, and 30 minutes later, the result will come back. Susie Q will become asked to come back from the waiting room and will be told exactly what she has and what the appropriate treatment or not is for that particular presentation. that is a massive sea change in the way medicine is going to be practiced. But in addition to being better medicine, it's also very attractive for a GP clinic to suddenly have an extra revenue stream that was previously being enjoyed by the bigger labs that they send all their samples to. So it's a double win for the patient as well as for the doctor. So to cut a long story short, those people that are interested in finding out more could go to MultiSeq.bio. That is our website. And if anyone that's listening is, you might say, in the investor class, a high net worth individuals, we'd be very interested in talking to you to determine your interest in assisting us develop this technology along those lines. I should also say, Nick, that the application in infectious disease is merely one of the applications of this technology. The other one, quite different, is even more exciting because it's called screening for cancer with a blood sample that's received the moniker the liquid biopsy. That's already in use in the bigger labs in the States, in which they are monitoring for the recurrence of a cancer, knowing that the mutations that were in it when the surgery was performed. The future of oncology will be to eliminate that unfortunate statement that we've all heard too many times, quote, "We caught it too late." In the future, you will be diagnosed and treated for the cancer you didn't know you had, catching it at a very early stage by detecting the mutations that are present in your blood at exquisitely low concentrations, picograms. But if you're doing that, you better be damn well right. We don't want to create the walking wounded, worried people with a false positive result. So in the future, you will be screened for cancer with a blood test in which a particular mutation is being looked for. If that mutation starts increasing in concentration, when you still feel perfectly well, no lumps, no pain, no signs and symptoms of cancer at all, you will then be treated for that cancer. The concentration of that mutation will be monitored over time and hopefully fall to baseline, when the statement will be made in the future, you have been cured of the cancer you didn't know you had before it had a chance to metastasize and kill you. That's the future of oncology, without any question. So that's a brief summary of the pipeline, what we have, how transformative it is. It's as big a transformation as MRI was in radiology. It's as big a transformation as directional drilling is for the oil and gas industry, for example. This is absolutely huge. It's a transforming technology, a disruptive technology that's meant to totally replace the dependence upon what everyone recognized during COVID as a grossly inadequate way of testing for infectious disease. So that's my summary, a rather long summary, Nick. I appreciate the opportunity of presenting to your listeners.
Well, listen, it's very, very transformative. That is an understatement. This is very, very promising. And, I urge everyone, go check out the website. Tell us again one more time. Give us the website, any other materials where people can go check out and, what they can expect. What's the current progress of the development and possibly approval of this technology. Give us your final words on that.
Sure. Just to repeat, the website is MultiSeq.bio. That's MultiSeq, MultiSeq.bio. It's a short form of multiplexing sequencing, which is the essential part of the technology. Remember that sequencing got the Nobel Prize by Fred Sanger many years ago, decades ago, but it's never been commercialized despite being the gold standard for the very simple reason it could never be used commercially because you can only do one test at a time. That's not real clinical medicine. You have to look at multiple possibilities at the same time. My personal email is roger@multiseq.ca. I'm currently living in Canada. Don't hold that against me. It's our lab is in North Carolina.
Awesome, awesome. Well, appreciate you coming on. Thanks for sharing this important development. And you're welcome to come back on as soon as any breaking news comes out regarding this, because this is big. This is very big. And again, I want to thank you for joining, and thank you everyone else for tuning in.